Welcome to Maryland Medicine Frontline News. Coming up, a School of Medicine faculty member helps to plan the distribution of life-saving vaccines. But when will it arrive? But first, we take you to the Baltimore Convention Center, where a massive COVID-19 testing operation is underway. With the infection rate soaring, hundreds of people have lined up outside the Baltimore Convention Center Field Hospital for free testing. Inside the 32,000 square foot facility, testers don personal protective gear in preparation for another long shift. They wear both N95 masks and face shields to protect themselves and the public. The operation is a model of efficiency, even as testing numbers soar along with the infection rate.
Today, we'll go over 50,000 tests done at the Convention Center since June 17th. We transitioned on November 5th to begin testing indoors. And we've been testing indoors since that first week of November. In November, the average has been close to 1,200. This week, it's been more like 1,000 per session as we've opened every day of the week now. We've seen both the number of patients tested and the percent of positive tests rise throughout November. Our last time testing, the rate of positivity was close to 7%. And we haven't seen numbers like that since early July.
The PCR testing program is a collaboration between Johns Hopkins, the University of Maryland Medical Center, and the University of Maryland School of Medicine. The tests are processed 24 hours a day, 7 days a week by the Institute for Genome Sciences and the Department of Pathology.
So samples are couried from the Convention Center up to this laboratory right here. They are accessioned into our EMR, electronic medical record. And that's where we verify all the appropriate information that's labeled on the sample, make sure that matches up and confirms into our electronic medical record. Once that takes place, there is an interface that links that information in the EPIC system over to our laboratory information system, which is called Cerner Millennium. At that point, it's a valid sample, it's logged into our laboratory, and then it's transported down to the second floor where the actual testing takes place.
Extreme care is used by lab technicians as they transfer the samples onto plates that allow for high-throughput testing. Robots are used to process hundreds of test samples at a time, checking for genetic markers rather than antibodies.
This is a step called RNA purification. And so what we do here is for each patient sample that comes in, we take a little bit of that sample and we put it onto one of these robots, and it extracts viral RNA. And that's the first step of the COVID-19 test that we're doing here.
Each plate has 94 test samples, which are analyzed in the final step to determine if a person is positive or negative.
We put them in these biorads, which then shows a fluorescence, and that fluorescence comes through within this graph. This is a positive detection of a sample, and what we do, we look at the RNA within the N gene, which is the N1 and the N3 gene within coronavirus, and these show that there is detection of that N gene.
I like to think that, I'm helping people, making a difference. People are sick and they need to know their results.
With the rising infection rate, pressure is mounting to distribute the vaccines as quickly as possible. Dr. Wilbur Chen is serving on the Federal Advisory Committee on Immunization Practices to assist with the logistics.
The federal government is coordinating the actual distribution from the point of manufacture and production to the individual jurisdictions. And then once they get to the jurisdictions, the state of Maryland, for example, then the state of Maryland will instruct how those vaccines will then be distributed.
Healthcare workers will get the vaccine as soon as this month, followed by people in long-term care facilities, first responders, and essential workers.
The prioritization scheme has been thought out under an ethical framework where we are trying to build in health equity. And we know that communities of color are overrepresented in this area of occupation, which is, again, agricultural, food services, transportation, manufacturing, all of these things that we need to have society function that oftentimes, we as a consumer may not recognize readily. They're really the unsung heroes that make America tick.
The general public should start getting the vaccine by late spring or early summer.
We are trying to develop networks and systems so that easy access is what we're trying to have as a goal line.
That's Maryland Medicine Frontline News. I'm Larry Roberts. Don't forget to follow social distancing guidelines as we continue through this difficult period of the pandemic.